You might have heard so many bad things about hospice. So, how does hospice disappoint so many people? Let's talk about it. Disappointment comes when expectations aren't met. And why on hospice are expectations so often not met? In this video, I'm going to explain what hospice actually provides, what you can expect from hospice, which will hopefully impact people being less disappointed when hospice doesn't do the things they think they're supposed to do. People often say, hospice kills people. Hospice left me alone when my mother was dying. Hospice wasn't there. Hospice doesn't do anything. So let's answer those questions. Let me clear this up for you. You know I'm a big lover of hospice. I think what happens is there's a lot of miscommunication and misunderstanding of what hospice actually provides. So often I hear or see in my comments that people think, even other healthcare professionals think, that hospice is this round-the-clock, 24-hour caregiving service that's going to be with them in their home the whole time while their loved one is dying. Or they expect that hospice is going to be the one that's going to be giving all the medications, or even the one that will be there when their loved one dies. And this is not the reality. That's why I think education is so key. The reality is hospice is only going to be there intermittently, teaching you, hopefully, how to care for your loved one, how to give the medications, and yes, how to be with your loved one in those last moments alone without a nurse while they're dying. Don't get me wrong, hospice does do a lot of things, which later in this video, I will get into what you can expect from them. However, it's not like a hospital. They are not going to come into your home and just do everything a hospital would do. That is for the family to do. I'll break this up into 3 different categories. 1, what hospice physically provides for you. 2, what you can expect from your hospice team. And 3, what the hospice team expects from the family. Hospice provides a medical team. You are literally signing up for the hospice benefit, which is a health benefit that Medicare pays for. If you don't have Medicare, your insurance most likely pays for it. They may get reimbursed from Medicare, but that's something for them to deal with. Overall, hospice is technically free. Medicare pays for it. So what you can expect them to give you is medications. So they will provide you medications. They'll provide you with a medical team, which consists of a doctor, a nurse, a social worker, a chaplain, a CNA, which is a certified nursing assistant, and a volunteer if you want that. And then other hospices also provide things like musical therapy, massage therapy sometimes, PT, OT, depends on what they have. Those things aren't required. Hospice is provided by Medicare. It's a federally funded program that Medicare is in charge of. All hospices basically have to look to Medicare. Now, if you're not old enough to be on Medicare, insurance companies also work with hospice companies. So generally speaking, 99% of the time, hospice is free. This is not something you have to pay for or think about. Out-of-pocket costs are generally covered. Other things we provide besides medication is equipment, supplies. We also supply the medical team like I was talking about, which I will get into a little bit later in the video. If you want to learn about the specific equipment and supplies we provide, watch this video. If you want to learn about the medications we provide, watch this video. So what to expect from your hospice team. This is key because I hear, like I said in the beginning of the video, hospice did nothing. Hospice was so disappointing. They weren't there for me when my loved one died. No one showed up for me. I want to validate how that must feel and educate people about why that's happening. Why technically the hospice company did nothing wrong, except for maybe the fact not educate you about the fact that you will be alone most likely when your loved one dies. So let me explain. Per Medicare guidelines, hospice companies and hospice nurses, that's one part of the medical team, hospice nurses only have to visit once a week, technically. So technically, per Medicare guidelines, once a week is enough for visiting. However, If your loved one is having a complicated case, many symptoms, things are going wrong, obviously the nurse will be there more, but you'd have to call the hospice company. If nothing is going on with your loved one for that week and everything's kind of status quo, that nurse will be there once a week, maybe twice because they have more time and they can do twice a week. But technically speaking, they only have to be there once a week. So I always say the more you call, meaning the more you call the hospice company, the more we will visit. However, we have to take the calls that we get on a triage basis, meaning like if you're calling us every day and just saying, I'm having a really difficult time caring for my loved one because they're too heavy to change in bed and I can't do it on my own. One, of course, we have empathy and compassion and sympathy for you. However, that's going to fall low on the totem pole of nursing visits because nurses are getting other calls from other families who are saying, my loved one's in extreme pain, my loved one's having shortness of breath, and those calls take precedent over the I can't care for my loved one. I'm going to address the I can't care for my loved one question later on in the video, so I will address that. That is a big problem, but technically speaking, when it comes to the hospice company and the nurse, that is low on the totem pole of issues we have to address in our day. The next thing, people saying, I had to give them morphine, no one was there when my loved one was actively dying. Again, as a hospice company per Medicare guidelines, we do have to visit every day when someone is actively dying, as long as we know they are. Sometimes people change very quickly and we are unaware. But if we know someone's actively dying, that nurse will come, or some nurse will come every day to check on you guys. But as long as your loved one is comfortable and the meds seem to be effective, we will not stay there a long length of time because that is not something that is needed. The nurse is not needed there to manage some kind of symptom because actively dying is not a symptom. It's a part of the end of life. Hence why, on that last day, your nurse might come to visit you and your loved one is actively dying, but they're comfortable. They'll say like, you're doing a great job. Everything is okay. Call us if they pass away or you think they have died. And then of course you're alone with your loved one while they die. And that can feel really scary. I definitely understand that, but it is normal for nurses not to be there during that time. Generally speaking, I know from myself, when I first started hospice nursing, I didn't realize that most people didn't know how it worked. Right? So I wouldn't educate about like, hey, listen, just so you know, when your loved one starts to actively die, we won't be here 24/7. This is going to really fall on you to do the work. Do I agree with that? No. But that's where we're at. I didn't even realize that families didn't know that. So it even took me, a hospice nurse, a couple years to be in hospice nursing to realize, oh my gosh, families don't know what to expect. They don't realize that they're going to be with their loved one, the whole time, and the nurse is only going to pop in here and there. No wonder why everyone's feeling like hospice doesn't do anything or hospice left me alone. That is, unfortunately, where we're at in hospice. Family does most of the work. And now that I realize that most families don't understand that, it's so important that we educate about it. So me, when I'm in my real life job as a hospice nurse, I educate my families. And now I'm here on this video educating you so you guys know what to expect from your hospice company. So let me discuss really quick what the rest of the medical team does. So the doctor is very involved, but you may not see them. Some hospices have the doctor come visit. And if you're on hospice long enough, the doctor will come visit because they legally have to because of Medicare guidelines. But really, the nurses are the eyes and ears for the doctor, and the doctor is making all of the medical decisions and then relaying it back to the nurse. But technically speaking, the doctor does not have to visit. Now, many times they will, like I said, if you're on hospice long enough or if your symptoms can't get managed, they will make a home visit. And it's up to the nurses to try to advocate for their patients whether or not the doctor needs to visit. But a lot of times, I'm telling you, they really don't need to visit. I think a lot of people have this thought that like the doctor's going to have better answers. That's just not true. I mean, the doctor and nurse are really working close together, and they're likely going to say and do the same thing that your nurse is saying and doing. So that's a lot of the reason why they don't have them visit. Also, you have to remember, or I even have to remember as a nurse, right? You have to remember as a person, and I have to remember as a nurse that as a nurse, we are seeing this day in and day out. We know what feels like an emergency or feels really scary, and we know what's normal. But you don't, right? You don't. You're not used to this. So a lot of times families will be really scared or really upset and really think they need a nursing visit right away. And the nurse just can't make it there because that nurse knows I have 2 other patients that are having a crisis that is more of a crisis than this one right here. Even though this family right here definitely feels like, no, we are in a crisis. As a nurse, because we're so used to seeing this day in and day out, we know which one is the highest level of where we should really take our time and go visit. So this family down here that believes that they're in a crisis feels like no one's there for them. Right? And I get it. And we will do our best as a team of people to help you not feel that way. But sometimes there's just a perfect storm, right? There's only one nurse and there's 2 crises and they have to pick the one that they know needs the immediate attention. So I think all of it has to do with education. I have a great example of this that I saw in my real life. There was a patient who had shortness of breath. That's a big deal. Then there was a family who called all the time, which is okay. We'd rather you call too much than too little. Called all the time, overly anxious just because they're not used to caring for their loved one, right? So they would call and call and call, and they called because they saw that their dad was starting to have a wound develop, which is a big thing. We definitely want to address that. But the bigger thing is the patient with the shortness of breath, right? So me as the nurse, I have to say, I can't see you right now, but I have to go see another patient. I will definitely get back to you and talk to you about how we can help with the pressure sore that's developing. But the family is scared and they don't like that answer, right? So they are already angry. By the time I get there, no one cares. You didn't care. The nurse doesn't care. They're already upset because we didn't see them right away. But I know as a nurse that I had another patient with shortness of breath that needed me more. Really, it's about communicating expectations, and it's a 2-way street. I need to be good at, as the nurse, talking to the family with the wound, which still needs to be addressed. It's still something that I acknowledge is a big deal, right? I don't want to not validate how they're feeling, but also knowing that there's something that's more urgent. Right? So just a matter of discussing that with them. And most people, 99% of the time, if you acknowledge how they're feeling and you realize it's scary and you will get to them, but you have to do X, Y, and Z first. Most people understand that, but it's a matter of communicating and educating. I have another great example of this. Like if you are a nurse on call, right? There's usually only 1 or 2 nurses on call at night. So if you get a call from a family and their loved one's having a seizure, you're going to go to that call first. And then as you're driving out to that call, you get a death notice, meaning a family has called in, their loved one has died. That is sad and scary for them. And we can't come right away because we have to go to that patient who is having a seizure. So this family is now like, what do you mean you can't come right away? My loved one just died. They're in emotional pain, right? They're scared and they feel like they're left alone. What you have to realize is that as a nurse, there's usually 1 or 2 nurses. And if there are things going on, this person has already died. So there's nothing that we have to do, right? If you think about the 2 scenarios as one is actively boiling over, we have a pot of water and it's actively boiling over. We need to turn off that burner. That is the seizures. We need to go there immediately and turn it off. The other pot is just simmering. It's not quite there yet. We definitely need to get there. But it's just at a simmer. It's not already boiling over. That is the person who's already died. And in this case, technically, once someone's died, there is no fire. It is not an emergency. It feels like one, and you are like, how can they not be here? I understand. However, technically, as a hospice nurse, this is not something that needs to be addressed right away. I always try to educate my families when I first see them about all of this, so they understand what the expectations are. So they don't feel as disappointed or as scared or as shocked that a nurse is not running right over once their loved one has died. And don't get me wrong, if we're on call and nothing is happening, there is no boiling water over here, we will come immediately out once your loved one has died. Depending on the state, technically, because some states nurses don't have to go, and not every family cares or needs that because some people have done this before, right? So it just depends. But generally speaking, if there are no fires to put out, we will take whatever call is coming in. I lastly want to talk about the CNA, which is the nursing assistant, who we all know and love. They are such a great part of the team. It depends on the agency, but technically per Medicare guidelines, the nursing assistant needs to go out as often as the family needs. Now, most hospice companies do not staff that way. They don't have like a million CNAs. So it's usually once a week, twice a week, 3 times a week. That's the general consensus from like all the places that I've worked. However, there are some people that have had daily CNA visits, but that's very, very rare. All of the daily care, generally speaking, the changing, the dressing, the feeding, giving medications. If your loved one lives at home with you, that is going to be expected of you. Hospice does not provide someone to come into your house and do custodial care. That's what those things are. It's called custodial care. The changing, the feeding, the dressing, the bathing. Hospice doesn't provide that. The CNA is not going to stay there longer than allotted. And the allotted time is usually, 30 minutes to an hour to get them bathed and changed and dressed. Okay, so I'm hitting you with a lot, I feel like. I hope this video is educational. I feel like it's really important we kind of set expectations before hospice even starts so people know that the hospice company they're working with isn't just like being awful or not doing their job. I always start out when I'm doing my admissions saying that, like 80% of the work, if you're going to be staying in your home with your loved one on home hospice, is going to fall on the family. It is. We don't think that's fair. Hospice companies are not like in agreement with this, but that is what we're working with per Medicare guidelines. Medicare is our boss, and Medicare says what we are allowed to provide and what we aren't allowed to provide. So the family is going to be doing all of the things. And sometimes the family can do it, and sometimes they can't. And when they can't, that is when the social worker comes in, gets involved. Social worker helps with a bunch of things, but one of the things they do help with is trying to help the family figure out how are we going to care for our loved one who needs 24-hour care in the home. And we can't do it. Sometimes that means paying out of pocket for an in-home caregiver. Sometimes that means your loved one can't stay home and they have to go to a skilled nursing facility or a boarding care. Sometimes some states have like hospice homes where they are living in the hospice home and that's who cares for them. But generally speaking, hospice does have different levels of care, meaning like we could have a continuous care nurse who is there 24/7, but per Medicare guidelines, they can't do that just for custodial care. They can only do that if a symptom is unmanaged. Any hospice that's offering a 24-hour nurse to be there, a continuous care nurse being there just for custodial care, is basically committing Medicare fraud because Medicare says you can't do that. Unfortunately, that stuff falls on the family, and which is why it's exhausting and it's hard because it's a lot to put on someone. What can you do about this? Okay, so if you're sitting here being like, well, what am I supposed to do then? If you can stay home with your loved one, but you still don't know how to care for them because you've never taken any classes on how to change someone in bed, how to dress them while in bed, how to feed them, how to give medications, all those things, you can ask your hospice company for education, for help. Can you show me how you do that? Talk to your CNA. Can you show me how you do this? Can you show me how to best turn them? Can you show me what you're doing? And they will teach you. Talk to the nurse about, can you show me how you give that morphine? How do you crush up this pill? What do I do if this happens? How do you do this? They'll be willing to teach you. And it's just going to take some time. My main thing is, always call us, always express what's going on with you. If you're feeling like you're not getting enough nursing visits and you would like them to visit more, you can always call and ask. Again, depending on their caseload and what's going on, if there's not an issue going on, they might not be able to visit. They might not be able to visit more than once or twice a week. But always just keep communication open. That is the main thing. And remember, expectation and communication are a two-way street, so you have to always keep those lines open.